Hi, this is Christina with Questions for a Nurse, and again, I'm reading nursing stories on Reddit. So this one says, I had a dude who is an open heart patient, pretty far out from surgery, but still had chest tubes. He was very frustrated about it since they hurt and it made it hard for him to ambulate independently. I can't remember exactly what caused it, but one night he had enough and he put on all his street clothes and walked out of his room. The bed alarm had all of us running to him, but as soon as he saw us coming, he ran straight to the fire escape, ran through the door, and jammed down the stairs with the chest tubes trailing behind him. Got about halfway down the stairs, but his reservoir is caught around the corner where the stairs turn. We caught up with him at this point, and suddenly he transformed into a horribly weak and in pain victim who couldn't move another step because of his back. Me, another nurse, and two security had to carry him like a piece of lumber up the stairs to his bed because he straightened himself like a board and refused to help back up the same stairs. Of course he did. I'm not sure how he managed to not only avoid any serious harm, but whatever surgeon did the stitches to his chest tubes must have been a sewing genius because they were still in for the most part. When we asked him why he tried to bail, he said he was tired of the views in his rooms and on the unit and wanted some fresh air. This was someone who was completely oriented and appropriate up until this point. Ironically, I'm pretty sure he was getting prepped to be sent home the next couple of days once those chest tubes were out. You know, it's really speaking of chest tubes. It's funny. We had a patient who got himself out of bed and like he was walking around the bed with his chest tubes fully pulled, and they too were in tight. And as a matter of fact, I spoke to the surgeon who put those chest tubes in because they held so tight like this. And he said he knows patients can do this, so he makes sure that those chest tubes will stay. And they're really hard to get out. They can, not that you would encourage it, but, as a nurse, it's just still scary to see the amount of tension placed on those chest tubes when they're put in. It's just absolutely scary.